America's Surgeon General is describing loneliness and social isolation as the next health crisis. It's become such a glaring issue that politicians are working together to try to create healthier communities.
Doctors, politicians, and researchers agree something has to be done to promote more social connection. The Surgeon General going as far as releasing an advisory declaring loneliness a public health epidemic.
While most people associate isolation and loneliness with mental health, there is robust scientific evidence linking it to these physical.
Social isolation increases your risk for heart disease, stroke, dementia, depression, and anxiety. According to the CDC, 1 in 3 adults ages 45 and older feel lonely in the U.S. Experts say there are several factors that lead us to this point. Among them, the divisiveness of social media and the pandemic shift to remote working and learning.
Certainly the pandemic accentuated an existing problem.
Now lawmakers are tackling the problem with a bipartisan bill introduced by Senator Chris Murthy.
Stand up in office in the federal government to study this problem of social isolation and loneliness and recommend ways that we can do better.
Some may think loneliness is a personal issue, but experts say that stigma is incorrect.
The underlying causes often originate in people's communities, in people's lives, where they work, where they go to school, their neighborhoods. And so there's certainly a role for the healthcare system as well as government.
Some politicians believe regulating social media would be a good first step, as many disappear behind screens for interaction, which is not as beneficial.